we're spending our money on the wrong things. We're spending our money on things that are designed to get people to temporarily feel better or balance lab values, but not fix the patient. Our 3 rules that we've had in place, and we've lived by this for a long time: patient first, compliance second, profits third.
Yep.
But it's important to get those profits. We don't want to put those profits ahead of other things, because that's how people got in trouble. But it's important that we actually show them a good way to get patients well in a compliant way, and it's profitable. And one of the biggest changes, as you alluded to, was the change in insurance. Insurance has not gotten better over the years. It's gotten worse for pretty much everybody, except for maybe the hospitals and drug companies.
Yeah.
So that's actually backfiring on them now, I believe, because we just elected a president who put a person in Health and Human Services who says, we're spending our money on the wrong things. We're spending our money on things that are designed to get people to temporarily feel better or balance lab values, but not fix the patient. And that's gone so extreme that now there's this recoil of, hey, let's start working on fixing the patient. So now people are reaching for what we do, looking for functional correction. And we hear now that the Health and Human Services are going to start trying to change the way they reimburse, for focusing more on function and not so much on symptoms, which is...
Yeah, that would be incredible. Yeah. It's interesting because our whole program helps doctors to focus on function.
Yeah.
And because our whole program works on teaching our doctors to focus on function, it goes right along with what's happening now, you know what I mean, in Health and Human Services. Yeah. I will say this, that chiropractic offices are phenomenal. And we've talked about this many times, that 10 to 12% of the population go to a chiropractor's office. And I get to talk to a lot of doctors. And there's doctors that see whatever number of visits they see, and they're making some impact. Then there's some doctors that are seeing upwards of 1,000 patient visits a week. In fact, I talked to one the other day, seeing up to 1,000 visits a week. And it's, first of all, job well done, seeing that many visits. But then you get this illusion that you're actually causing an impact, that when you actually back up and you realize that 10% of your market is coming to a chiropractor, you're capturing a good amount of that market, which is great. But 90% of the people in that market are still that broken healthcare system. Yeah. And so to create the real impact, we have to bring this type of care to 100% of the population, not just the 10% that go to chiropractors. So when we talk integration, AMI's mission and vision is to transform this pain space. It is to make it so that, as I've heard you say before, less invasive care first, most invasive last. We have a system right now that's most invasive first with drugs and surgery and least invasive last. It shouldn't just be for 10% of the population. Yeah. 100% of the population should have access to this, which is why the way we set the model up, it brings it to 100% of our doctors' community, basically.
Yeah, there was a joke, I think it was on the Far Side, one of those cartoons, but it was a doctor saying to the patient, we've tried everything that modern medicine has, there's nothing left. The only thing I could suggest to you is you might want to try alternative, which has a lower injury rate and a higher success rate, and it's a lot less expensive. And that's what we've been doing for a long time. For the first time in my career, I'm starting to see the public say, you know what, that is what we're getting, and I'm getting tired of it, and I want to see something different.
Yeah.
There's an opportunity here, not just for chiropractic, for all alternative healthcare, but since chiropractic is the largest alternative, we need to step up to the plate. And I think integration is a great way to do that, because there's so many medical people that agree with our philosophy right now. I just saw a quote, and I forget who said it, but they were saying that they believe over 50% of the people who work in hospitals think we're over-medicated and get too much surgery. And with that, you got that whole community out there where if you say, hey, would you like to work in an environment where we're not hurting people? Obviously, everybody wants to help them, and instead of focusing on getting rid of the pain, we're focusing on fixing the problem, which gets rid of the pain permanently. That's, I think, where we're at in this country right now. And it's a great opportunity if we don't miss it. Now's the time for us to stand up.